My name's Eric Jolly. I'm president and CEO of the St. Paul and Minnesota Foundation. We're a community foundation, and that means we get to work with donors and with passionate nonprofit leaders come together to change the world, our world. And these relationships give us a window into tremendous acts of generosity, inspiration, courage, and love. Every day, from small towns to large cities, we're seeing people, individuals, and communities coming together to create an equitable, just, vibrant Minnesota where all communities and people thrive. In this present moment, we'd like to share these stories with you. As we get started, Barbara, would you please tell us a little more about Think Small?
Think Small, our mission's to advance quality care and education for children in those crucial early years. We work with childcare providers, providing training and coaching and all kinds of ways of supporting them. We have a publishing division called Red Leaf Press, and we publish quality early learning materials that are sold literally around the world in multiple languages. We have 22 products that have been translated into Chinese, as an example. We also are a public library for early childhood. We're an early childhood library, so we are a branch off of the St. Paul Library. We administer early learning scholarships, the Ramsey County Basic Sliding Fee Child Care Program, and we have a texting program for adults in children's life to help them do things to have children ready for kindergarten. That's one of our newer projects, and we've got 10,000 families right now that are participating in the texting program. And then we have a whole policy division too, where we try to catalyze change. So we try to work on the front line, take what we learn there and translate that into policy in our work, both at the state and federal level. So that's Think Small in a nutshell.
Question that I have as we began to work with state leaders and imagine the impact of COVID-19, I recall early on the governor's concern, would there be child care support, frontline service providers, those who are staffing our hospitals, our clinics, our police and emergency responder units. And I know that you were on the front lines in those discussions. How has the COVID pandemic impacted your community and the community of people you support and work with?
You know, it's been a significant impact. The child care as a business was fragile going into this pandemic. We were experiencing in Minnesota, like many states, a significant number of closures in childcare. So we were already worried about our capacity. And we have something called Build Your Own, where we're helping recruiting new providers into the field. We were doing that prior to the pandemic. That's probably going to be even more important when we come out of this, because we have programs that are closing that we're not going to be able to get opened again. It's going to be a serious economic development issue, besides the issue that we know it is for having high quality childcare available for children that may be experiencing opportunity gaps. People immediately lost large numbers of children from their care, so it became a business issue right away for folks to try to stay open. That's when we went into our reserves and pulled out $100,000 to start making small grants to family child care providers to try to help them be able to stay open for essential workers.
That's fine. I just wanted to say, I think that's extraordinary to make that kind of transition and to pivot through your own budgeting process and work down reserves to ensure that we had essential providers available for the state. I appreciate that. We
opened the application for those funds, and I remember it had been open 15 minutes and we had 150 applications. We went up to 1,300 in the first 48 hours. It was a significant response. Childcare providers, you know, they were like all of us at the beginning of this. They were frightened. They are frightened, not sure what we're going through, not sure the best decisions to make, being concerned for their family, and having a great deal of care and concern for the children in their care. they are the true heroes in this. They have stayed open in numbers that are allowing essential workers to work and maintain their childcare. It's not easy. We also early on found out that providers were having a very difficult time getting supplies, getting sanitizer and bleach and things like that. So we started working with our partners at Child Care Aware, and we literally spent a couple weeks setting up supply chains to distribute sanitizer and bleach around the state to child care providers. So we've done over, I'd say 2,000 gallons of each around the state in the last few weeks.
That's really amazing. You've seen a lot of people responding in so many different ways, constructing new supply chains, or responding to the fears that the providers themselves have, both for their families, those who are in their care, and for the finances and economics of their future. What have you seen that's inspired you and maybe given you hope?
The things that have inspired me the most have been the stories from the child care providers themselves. And we have launched on our website a series of stories from providers called Long Story Short, where we have been following up with them on the impact of this and trying to let them tell their stories. They're worried about their businesses and whether they'll be able to stay in business. They're worried about the children in their care. We launched a project a week ago where we're in the process right now of calling every family child care provider in Hennepin and Ramsey County just to touch base, to see what's going on and to see what their concerns are. It's a big mental health pressure to be in this situation with all that you're juggling. And so we wanted to at least let them know we're here, and we wanted to hear from them. So we're trying to tell those stories. Elisa is a family child care provider in St. Paul. She runs a bilingual program. She immediately lost half of the children in her care when this happened, but the children that were still there were children of essential workers. She's serving those children and doing it very bravely, and she's FaceTiming with the children that are home with their parents just to help them stay connected. She's very worried about what the impact is on them because they don't understand why they aren't seeing their friends every day and why they don't get to come see her. She's a true hero here.
One of the things I love about that story is it's about helping illustrate the way in which adults connecting with kids build the resilience in the kids and bring children into a strong future. I know that you were a recipient of Minnesota Disaster Recovery Fund grants.
Yes.
Can you tell us, how did that funding help the communities you work with in your programming?
Significant. We received $200,000. We were formally notified on a Monday. We awarded all of those funds to family child care providers by Wednesday. In the case of Elisa, she used that. She has a part-time worker in her program that allowed her to keep that person working during this period of time. It allowed her to get additional supplies because she was putting additional cleaning things into practice to help make sure that she kept things safe for the children and for her own family. So there are a number of ways, but folks have been so thankful and grateful that people realize the importance of the work that they're doing right now and the importance of what they're doing to support children and the importance of childcare in general.
One of the lessons that I take away is as we entered into this COVID situation, many realized that we needed immediate relief and assistance in the crisis that was there. How do we provide for people in the immediate term their safe homes, safe places for children, food, health care? But we know that we have to find a pivot to recovery. And in recovery, we have to say, what's our longer vision? Where will we be 6, 12, 18 months from now in terms of services? And you've really worked hard to ensure that our child care providers will still be there at some level as we emerge from this crisis, and that our children will not have lost a year of development during this year of isolation that we may be facing. Can you tell us more? How can people support your work in the community? What can we do for you for Think Small and for all the things you care about?
We're very worried that our opportunity gaps are deepening as we stay in this crisis. And so we very much want to have resources that allow us to keep being creative, to coming up with innovative solutions. And that's what we do with our philanthropic dollars. The heart and soul of what we do about seeing an issue and trying to come up with a creative solution to that, and then seeing whether it's something that could or should be scaled, and then doing the policy work to make that happen. That's where our heart and soul is. And so that's when people are able to contribute to us, or we're able to get grants to help us. Those are the things we're able to do. That's where we develop a texting program, or that's where we knew $1,000 would make a difference for a family child care provider, because we had tested that a year ago. And so we have some ways of doing things like that. And when we have resource to be able to do that, and it's a very small percentage of our budget, but it's very significant to the quality and heart of what we do and what we're able to do to support children and the adults in their lives.
I want to thank you for being with us in this present moment. Barbara Yates, you do wonderful work. Thank you so much.
Thank you so much, and thanks for the opportunity to talk with you this morning.